Perfecto, súper. Muchas gracias. Buenas noches. Hoy vamos a... Exacto. Adelante, secretario, por favor. Buenas noches, son las 19 horas con 3 minutos de este sábado 30 de mayo. Y hoy vamos a hacer una demostración. En este sábado vamos a dedicarnos a dos cosas, como siempre, el informe técnico, que voy a tratar de que sea breve, para que procedamos después a elementos adicionales que nos compartirá nuestro secretario de Educación Pública, el maestro Esteban Montezuma Barragán. Muchas gracias, secretario. Y también el maestro Zoe Robledo, quien es el director general del Instituto Mexicano del Seguro Social y quien está a cargo de coordinar todos estos elementos que tienen que ver con la implantación de los protocolos de seguridad sanitaria en el campo de trabajo.
Health measures in the work field. We're going to give you a demo of the changes that we are going to develop and the reasons why we have prevention implications. So I'm going to be very brief in this first piece. I'll be now introducing and presenting the technical report. Okay, so this is day 69 of the national campaign of Safe Distance. No damage, plenty of benefit to complete 70 days. Tomorrow is May the 31st, maybe tonight and tomorrow, the whole day, mainly everyone will be at home. Anyway, the day after tomorrow, June the 1st, next Monday, all the state authorities will now come to give their local provisions that are under their jurisdiction at a state level, and that would imply then a decision making on activities that will be kept without any function just yet. And considering the stoplight of COVID, the risk stoplight that was presented last Friday here, that you all know, where all the states, with the exception of Zacatecas, that is in orange, and that would be meaning still high risk, the rest are in the highest risk. That would imply, according to provisions coming from the federal authorities that have been published and that are compulsory, that were published on May 14th and 15th. Those activities are specified in terms of conditions for reopening. At an international level, 5,817,385 have suffered from COVID since the epidemic began in the world. From there, 1,391,731 would be the 24% confirmed in the last 14 days. 6.2 is the lethality global rate, and the Americas region is still increasing and representing the highest activity in these last 2 weeks. This chart is about the last 14 days. Europe is descending, and in the last 3 days, the Eastern Mediterranean is stable in the ratios compared to the world. In Mexico, since February 28, when we had the first confirmed case of COVID, 87,512 have been confirmed. From those, 16,486 have been actively confirmed in these last 2 weeks. 9,779 people have lost their lives as a consequence of this epidemic, and we've studied 270,992 cases that have been studied. From those, we have the confirmations and also some discards. This is a map of the cumulative registration of COVID. In spite of being this the last 14 days, we have a contribution in the sense of infecting, and we are always interested in keeping the registration from the beginning of the epidemic. 87,512 are representing the population, where 68.5 people are suffering from COVID in 100,000 inhabitants. This is a column chart where we can see the constants in the epidemic began, and the zone that has been very badly hit is Mexico City, with the fourth of the population. The cases that are recent, 16,486 confirmed cases, are on the map according to intervals of presentation of cases. And in the next chart, we can get to see with more clarity the same thing. Mexico City and the metropolitan area, including the state of Mexico, would have the highest frequency of recent cases. Then we have Tabasco, Puebla, Baja, Chiapas, and Jalisco that is now approaching the this increased top states. According to the number of inhabitants in each one of the states, we can then make the proper comparison. Practically 13 persons per 100,000 inhabitants have been suffering from COVID in these last 2 weeks. That's something we can get to see in this next column chart, where we can identify the comparison. And let me remind you that the methodology we've been using for the last few days, when we incorporated the gray bars as the comparison checkpoint. In any of the pair of bars where green is higher than gray, that means that in these last 15 days, we've been seeing greater incidence than in the previous 2 other weeks. But if we go to Querétaro, we can then get to see consistent patterns of change, where the chart, the column, I mean, the gray column representing more, older cases, are now being greater, and that's how the epidemic is diminishing in these states. The deaths are shown on this chart. We began on March 18th, where we had the first demise, and the increases in demises were presented in daily packages according to confirmation of deaths. Today, we had more than 340 in respect to yesterday, and indeed, this would correspond to many occurrence days that are distributed as we are showing on this chart. 801 are now under the process of analysis for confirmation purposes. According to the states, we have here the deaths. It's not varying. We have Mexico City, the state of Mexico, Baja, Tabasco, Veracruz, Sinaloa, Puebla. And this is our chart according to the onset of symptoms exhibition. As the chart presents, we can also get to see that 38,994 in yellow area are still under analysis. Let me remind you that these are not the same people. Some are new, others are going to confirmation red color. And this is our cumulative curve from yesterday until today. We have 3.4% according to what we saw yesterday. That is to say 2,885 new cases that are confirmed, that are now summing up 87,512. Our COVID hospitals are 787 with no variation from yesterday, and 98% have been notifying. We have 40% of occupancy. Practically, data has not changed. That's something we can get to see in these other column charts, where we have on the right hand hospital, the average hospital occupancy 40%, and on the left, We have 70% for Mexico City, 62 for the state of Mexico, and you can read the rest for general hospital beds. And in the next one, we have the occupancy of beds for people who are critically ill. That is to say, ICU, 35% of national occupancy on the right, and on the left, we can get to see the order of 69% for Baja California, state of Mexico, 61, Chiapas, 57, Mexico City, 56, Guerrero, 50%. That'll be the technical briefing. Now we are giving the floor to Esteban Moctezuma Barragan, our Secretary of Public Education. Thank you very much, Mr. Undersecretary. Greetings, Zoe. Good evening to everyone here. And I'd like to go deeper about the protocol for going back to school. And as you may recall, it is going to restart our cycle from 2020 to 2021. That'll be in August for basic education level. And what we are thinking is that after analyzing that the way in which we must return and go back to school, we should have a pedagogical content and sociological as well. We don't want our children to develop themselves with fear to the others, thinking that the rest of the people would be a potential threat. What we want instead is that they could understand that we need to take care of others, take care of themselves in turn, and as we take care of ourselves, then the society will be able to get ahead and interact. And this is essential because it is going to be part of everything that we are developing in such a way that by keeping safe distancing and with the protocol that we are on the brink of showing you, we won't be reaching extremes as we are seeing. The protocol to go back to school includes 9 interventions. The first one is going to be conducted by the participation committees for school health. These participation committees have created when we announced on March the 15th that we were going to leave a school on March the 23rd was precisely because we wanted to of that same week in order for us to prepare teachers so they could then be able to orient their students to take their books along with them so they could take them home, and that they would be given the guides in order to study the textbooks. Another important point was precisely to create in schools this participation committee of health, of school health, integrated by the mothers, the fathers, the teachers, the principals, and what it is looking for precisely is that this is a group, a collective, taking care of the health around the school, that we would all be committed because health in the end is to be taken care of at school. It would be useless if a school is imparting lessons about nutrition. For instance, if children get home and eat everything that is not supposed to be eaten. So we want to establish that relationship between the school, a household, in order to strengthen education in Mexico. An important topic would be the relationship of the school with the local center. What we want is that we have enough training for the principals and teachers so they will know what to do in the case of an emergency, that they would not require to think in the moment the incident is occurring, that they can have a notice with very noticeable numbers to come up and react immediately. We also have sanitization, cleanliness as another factor before going back to school the previous week before that. This committee is going to organize campaigns to the schools in general terms. This should be taking us and lead us to have a dynamic established in schools in terms of routine cleaning. So for schools to be kept clean, and not only because of SARS-CoV, but because we want any waste and trash and littering to stop. We want students to learn how to live in a healthy and clean environment, because hygiene is health and health is well-being, and we want the well-being of our children. Another important topic would be the corresponsibility checkpoints. Why? Because we are all co-responsible for this effort. This effort gets started at home. It is reinforced when pulling into the school, and it would continue in our classrooms. For starters, we are going to ask the parents that in a way that would be completely practical on every piece of paper, on any sheet, to write that no one in their families or their daughter or son directly, apparently, and because they could not know, they are not experts, that they have no symptoms display or exhibiting any symptoms. So the children could then arrive with that statement coming from their households. That would be the first checkpoint. And then the teachers would be pretty attentive of each and every one of the students. In this committee I'm addressing, we are going to establish the permanent hygiene measures. In here I'm addressing the sneezing, that we should be teaching our children on how to do it properly. We are also addressing the meaning of safe distancing, greetings, just by touching their hearts, but not handshaking or hugging or kissing. That'll be afterwards. And from all those type of practices that are going to be pointed out by the committee, we are going to have formal training. And this is precisely being designed by the Ministry of Health. Hugo Lopez-Gatell told us, along with the ministers of education, for formal education importance. And every school is different, and in a country like Mexico, for sure, we have huge differences, but we need, as it is possible, to establish signals all over the school, so walking would avoid any crashes, and at some point we can then walk around safely. And for that we need signs. These signs wouldn't have to be expensive or specialized. We are just talking about any regular, no homemade notice that we can develop. The second point in regards to these interventions would include to guarantee the access to soap and water or every school. This is very important, because the most effective way, as our undersecretary has told us, in order to prevent infection would be to permanently and constantly wash our hands. And we want that to happen in every school, and that's why we've developed a special effort in La Escuela es Nuestra, the School is Ours program, where we are
más de
sending
28,000 escuelas y vamos a
resources,
llegar muy pronto a cerca de 47,000.
28,000
Y ese recurso,
schools, and we are
muchas de
going
las
to
escuelas
reach
que no tengan agua
47,000
lo van a
soon.
emplear
And for
para
many
poder
of
tener.
those schools that do not have water
El
are going
tercer
to use
punto es el
resources in
cuidado de
order
maestras y
to
maestros en
get it. The
grupos de
second
riesgo.
bullet would
Es muy
be to
importante para todos
then
nosotros
take care
cuidar
of
al
teachers
magisterio, cuidar a
in
nuestros
risk
maestras y
groups.
maestros.
We need to be
Y
very
para ello
careful
estamos
with our
precisamente
teachers.
conversando con el
And
ISSSTE
for that matter,
para
we are
tener un
precisely
seguimiento y un
establishing
cuidado especial.
conversation with the
Yo quiero señalar
healthcare system
que
for government
afortunadamente dentro de toda
workers.
esta
And I want
estrategia
to stand out that
para
within all the
luchar en contra de
strategy,
la pandemia,
in order to
hemos
fight
puesto al
against the
final
pandemic, at
el
the
regreso a
end,
clases, así como fue
we
el
have
principio
placed the
en donde
going back
el
to
receso
school
escolar
period,
fue
just
la
as we
primera
had
acción
an onset
que se
and a
desarrolló,
pause
así
as the first
tengamos al
action
final el regreso a
developed.
clases.
At the
Y
end,
no es cosa
we are
mía,
living the way in
porque
which
todo
we
el
are going
sistema
to return to
educativo,
school.
maestras,
And the
maestros,
whole education system, the
alumnos,
teachers,
todo el sistema
the
educativo, trabajadores
students,
de la educación,
the
de
education
los
systems,
niveles
any worker in the
básico,
system,
medio
from
superior
the
y superior,
basic and
suman
the
40
mid-high
millones de
and
personas.
high education
Entonces,
are
cuando
counting for
se retiró el sector
people. So
educativo
whenever
de la
we
actividad
lifted
pública, lo que se
and
hizo fue sacar
retrieved
a
and
40
took
millones de
away
personas.
the system, what we
Por
did
eso
is
es que
that we
nos ha explicado varias
also the
veces
activity of
Hugo
40
López
million
Gatell
people. That's
lo
why
que eso
we've been
significó para
explained many
evitar
times by
que
Mr.
tuviéramos
Dr. Lopez
una
Gatell what would
gráfica
have meant if
de
we hadn't
contagios
done
realmente
that.
alarmante.
Then
Y lo mismo,
our
estos 40
infections
millones
would be
van a
more
entrar hasta el
than
final de esta
shocking and
crisis al
alarming.
semáforo
And
verde.
these 40 million
Cuando esté el
will
semáforo
be
verde,
to activity whenever we have the
ya
red,
va a estar
I mean the
totalmente
green light,
levantada
the
todas
green light. That's
las
when
restricciones
we will then
de la
lift
Secretaría de Salud y del
restrictions
Consejo de Salubridad
in
General.
full
Se va a poder ir al
from the
cine, se va a poder
Council of
ir a los
Health
centros
and the
comerciales, al
ministry. Then
mercado,
we'll be able to
no va a
go
haber
to
problemas
malls, to
de
supermarkets, to
convivencia
the movie
normal,
theaters.
aunque
There
todos
will be
deberemos
no
siempre
issue with human
de guardar
interaction. But anyway,
ciertas
we will need
prácticas
to keep
de salud
certain
que son las
practices,
que hasta ahorita hemos
health
aprendido.
practices that
Entonces,
up to now
las
we've
maestras y
been
maestros en
learning.
riesgo
So teachers
van a
that
regresar
are on
cuando ya haya
risk,
el
they
menor
are
riesgo posible
going
y
back to
una
school whenever the
normalidad
risk has
en su vida.
been
Tampoco pueden
diminished as
quedarse
much as
en su casa toda
possible.
la vida.
Of course, they
Hay unos que
cannot be
deseen
kept in their
retirarse, pero
households
vamos a tener un
forever
programa
unless they
para
want
su
to
atención
retire. But we
y
are
su
going to
cuidado, pero cuando
establish a
regresen
program
van a
for
regresar
taking
en el
care of
momento
them.
en
But
que va a
whenever
ser
they go back,
menos
they will
riesgoso
do
regresar porque
so
estaremos en verano.
when it is not going
La
to be
cuarta
that
intervención
risky. The
es
fourth
cubrebocas
intervention
o
is
pañuelo
to
obligatorio.
use the mouth coverings
Todo mundo
or
puede
maybe
fabricar un
some
cubrebocas con un
tissues.
pañuelo de
We
2 metros.
can all manufacture
Todo mundo se puede
ourselves
amarrar
a mouth
un
covering
paliacate.
with a piece of
O sea, no se
clothing,
trata
and
de que sean
we can
cubrebocas,
also use
llamémoslo así,
many
sancionados
other
judicialmente por
types
estas
of
personas. Se
handkerchiefs.
trata de
And
que en la
it
convivencia,
is
niñas y niños,
because
maestras y
in the
maestros
interaction
aprendan
between children
a
and
que
teachers,
cuando uno trae
all of
un
them
cubrebocas,
will learn that
está
whenever you
cuidando al
are
otro,
covering your mouth,
porque al
then
hablar
you are taking
no le está
care of
llevando
the
al otro
others,
a
because
que uno
whenever
emane.
you speak, you
Y si el otro
won't
tiene
then
cubrebocas, me está cuidando a mí.
be
Por
spilling
eso, como empezamos
droplets,
esta
and
plática,
that's how the others will take care
no
of
vamos a
me
tener
as
miedo,
well.
sino que nos vamos a cuidar
Started. We
entre
are
todos.
not going to be fearful. We are going to be.
Quinta intervención es la sana distancia.
The
En las
fifth
entradas
intervention
y en
is
las
the
salidas
healthy
habrá un protocolo de
distancing
sana distancia muy
when
claro para
going
seguir.
in and going out. We are
Los
going to have
recreos
clear
serán
indications
escalonados
for safe distancing.
para que no se
The
junten todos los niños a la vez
the
y las
process
niñas en el
would then
patio.
be
Habrá lugares fijos
staggered in
asignados
order to avoid
para los
crowds. We
alumnos.
are going to have fixed
Esto es para que
spots for students.
sepamos en caso
So
de que hubiese
then
algún
we
contagio
will know
quiénes
in
conviven
case
más
we have
alrededor y se
some
tenga más cuidado
infection,
con esos
we
niños
will know
en caso de que
who
así sea.
interacted, and then we
Y
can keep an
una
eye on
asistencia
those
alternada a la
groups.
escuela
And
por apellido
also we
durante todo
will
su
have
regreso.
an
Esto
order
también
of
es totalmente
presence
novedoso.
in
La
the
vista
classrooms
de la
by
escuela,
using
de
the
los
last names. So half the schools, half the classrooms will be taking lessons from Monday to Wednesday in according to the order, alphabetical order of their last names. So we can then pick up, their families can pick up their children if they have more than one. I was saying from A to N and from N to C, so some would then alternate turns to go to school. For those that go on Thursday, they are going to research, they are going to work on their projects, working on their textbooks, they are going to on Tuesday, and those who attend on Tuesday are going to work on their personal projects on Wednesday. And we are in a remedy period, as we've been calling it. Teachers then will be able to see children that are staying behind, and they will get their special attention on Friday. So that is going to allow for something very important, that whenever we have very large groups, is not that is called customized attention. It is not just about teaching and imparting as a teacher, it's about teaching individuals. And that's why it is necessary to know how they are doing in their emotions, what they experienced during the pandemic, so that we can work directly with them. The sixth is maximizing the use of open spaces. If it is possible, maybe we can teach in an open place instead of the classroom. The seventh would be the suspension of any ceremony of gathering, congregating everyone in the school. Maybe we can have a ceremony in the outdoors while the others are in the classrooms, not to get them all together. And eight would be early detection. We have a protocol in place for that, but I want to stand out with that with the only one case of infection, regardless of who that might be, maybe teacher, student, or any type of person, we would be closing as long as the ministry would indicate. And the ninth would be the social emotional support for teachers, for both teachers and students. With these interventions, going back to school is going to be very safe, and this will have for all of us the guarantee that it is going to entail the list of the risks, as it has been repeated. And I'm saying this because of what the undersecretary has told us. We are not going out of this problem until a vaccine is implemented. Until then, we will always have a slight risk, and as long as we are aware in prevention, then we will be able to control the risk. Thank you. Okay, thank you, Undersecretary.
Maestro Zoe Robledo. Después abriremos a preguntas.
Muchas gracias, subsecretario.
Thank you so much, Secretary Moctezuma. Thank you so much, everyone, and everyone watching this transmission. Thank you so much, everyone. The health staff and the one from all the institutions, they are all making a great effort to save lives from all Mexicans. As we've been mentioning, the same way it happens in school and in the workplace, one of the main tasks of the Seguro Social is to prevent disease and protect the health. It was before COVID, and it's currently right now in this healthy return to the economic activities. And that's the way it must be, because the new normality, new normal implies to do new things. It implies for everyone to cooperate, so this return to be safe, healthy, and with solidarity. In this sense, as we have been mentioning, in the last 15 days, we began our work for a specific mechanism for enterprises, new essential enterprises. Why do we call them this way? Because since March, there was a series of companies and economical activities that must continue working because in the middle of the pandemic, there are activities that cannot stop. Clearly, the most important, all the health services and all the change related with it, but also banks, gas stations, supermarkets, hardware stores. There are plenty of companies that continue with its work. And in addition, we add, beginning on March 18, these three industries: mining, transport, and construction. With them, we have this interesting effort and different effort than the ones with the essential ones. We request from them to have a self-evaluation of the protocols that they were creating facing June the 1st. And many of them, particularly from the transport and mining industries, they began and they were able to start their activities actually before of June the 1st. That's to say before Monday. These providers, 17,854 companies, distribute in the following ways per size and per sector. This has been very important for one reason. Yesterday, in the official diary of operation, Ministry of Health, Economic, and Seguro Social, we published the technical guidelines, specific technical guidelines for the return to the economic activities. These three sectors, and it also applies for those essential original essential sectors, the one that I just mentioned: banks, media, telecommunication, messaging services, supermarkets. Everyone who has continued working and has conducted protocols, but now we are requesting from them also to register, with one difference: they won't have to wait for a validation. This will be self-validation. The registration, according to the published guidelines, it is mandatory, and this is very important for everyone to be aware, particularly those watching us at home and will restart activities or are conducting activities. We have detected that some companies have done marvelous. They have created extraordinary protocols, strict protocols, and there's plenty of responsibility. That's the way it should be for all of them. That's why we brought some examples that you could see here. For instance, in the desk, in the left side, to Dr. Hugo Lopez-Gatel, we have this barrier. This is a physical barrier for office places in the workplace. What is it for? When we are not able to have a 1.5 meter distance, the so-called safe distancing, in this table, we have always respected this distance. When we are unable to have this, then we need to have this physical barrier like this one. We can go to the next slide. Here we have some examples that we would like to show you. Entrances, and for all workplaces, constant infection. Let's keep in mind that, as Dr. Lopez-Gatel mentioned, we have many days of conferences, and we mentioned day after day, this virus, it is not in the air, it is in the surfaces, and we are the ones that when we touch a surface, we can touch a surface with our hands, and then we touch your face, particularly your eyes, nose, your mouth. That's why it's so important to disinfect all the common objects. Let me give you an example. In Seguro Social, the checkers that we use in many companies, sometimes checkers, we need to put our fingerprint. And sometimes a technique we need to get rid of it is those people licking their fingers just to clean the checker. In new normal, will imply that that should be socially discouraged. Everyone touching their mouth and then touching objects which other people will touch, it should be completely forbidden. Those are the type of things we must forget about. And we will remember those days when we used to do something like this, which is really risky in a workplace, particularly in an object, a common use object. That's why the infection, hygiene, and safe distancing continue to be the best tools, the most effective ones. the ones with a massive implication. Next slide. It has to do with hygiene areas loose in proper condition. Today, bathrooms must be clean, but particularly they must have a supply of water and soap, something as simple and so powerful at the same time to ensure that the return to workplaces do not imply massive contagion or outbreaks in some community. Water, soap, and disposing towels. Next thing is gel alcohol in several places of the workplace. There are some strategic places. I know a lot of, because many people is going over there, or the checker points where you check your arrival. We must have these dispensers of alcohol. These strategic spots are established in the guidelines that we have published and in the self-evaluation where we ask these companies if they are doing this or not. Next slide. This health distance is in production areas, physical barriers which must take place. Before there were very small distance, there was plenty of possibility for contagion, and now we need to get used to this type of barriers, particularly on the sides and in the front, and also in the production areas, not only in the offices. For instance, those in production lines, which implies someone in front of a machine, they must also have this type of barriers. In meeting rooms, particularly when it is impossible to have a teleconference, then in the meeting rooms, we must indicate the spots when everyone must sit. And the same happens for when you're in front a device, for instance, a photocopy machine, because sometimes people is in a queue, and then we will need to have clear marks as Moctezuma secretary. These are not just complex signs. We just need to mention the space to ensure safe distancing. I'm sure this will become natural in the future, but right now we must be extremely careful. Next slide. For instance, common areas in places where we have coffee shops or dining rooms, like in these big companies, in many of them, they have common areas like these. And in the past, there were these type of situations which were very common. Now we must take care that these signs will allow us where we should walk and in which sense. Next slide. There it used to say is only burgers. If you can ensure the type of food, that would be useful. This distancing in common areas, for instance, on the dining room, we must have some safe distancing in those places. Next one. Physical barriers in these common areas, these are real examples sent from different companies, and they're actually doing it. For instance, this is very important, very simple. If we have seats, we can have fixed seats which cannot be moved, and we just mark the one can be used and the ones that cannot be used. Next one. The same will happen in the transport. Personal protection equipment. As Esteban Moctezuma secretary mentioned, it is quite similar. What are the fundamental pieces of equipment? Masks, and also eye or facial protection. That's why we have this example. It was provided by one of the companies, Hitachi, which creates auto parts for the car industry. For instance, this face mask in the places where this is possible, and also the mask. This is very important for all these companies related with customers. For instance, a bank. Fortunately, in most of the banks, there is a physical barrier. If there is a physical barrier, we don't need this facial protection. Yes, the mask, but no the facial protection. If we are not able to have a physical barrier, for instance, in the gas station, then we must have the mask and the facial protection. Those are things that will prevent that in those places where there is a lot of flow of people, the customers, so we prevent that either the customer infect the staff, or if the staff prevent to infect the customers. Here we have some of these examples, something that continues to be very important to enable home office, not only for workers, also if it is possible for managerial or office work that can be put to home office or home office in the same workplace. That is something we must get used to. If in a building, if a 10-story building, we're going to have a meeting involving people from each one of the stories, we can have this distance meeting even if it's in the same place, because it's much better and more efficient, and we will prevent to have these huge spaces for conferences. For instance, a meeting room of a lot of people, we could have this meeting, distance meeting in the places that enable this or that allowed us this. The thing that we were talking about transportation, those places where this is possible, where it's possible to have these places or indicate the places that are useful. Next one is an example, a very clear example. I'm sorry, there was a previous one in terms of how to locate people in a cross way in places where they can be seated. And something else that is really important, the promotion of health, training, information, permanent information of several topics to orientate people about this disease so we can be safer. I think there's something very important in terms of what we were talking about school. If exercise has to do with school and home, it is the same, workplace and home. There must be a behavior that you can take home. Of course, we are not suggesting to wear a mask and everything else in your home, but we're suggesting certain hygiene measures that they must follow not only once they are out of the workplace, and not go back to dangerous behaviors, and instead taking these good behaviors to home, orientation, training, and organization. Next one. I think this is the last one. These are the same online training that we have been mentioning. They are open access. The media is also able to access this website for COVID, advices in the workplace, what to do when you have a COVID patient in the home. There are 5-6 hour training courses, and you will actually get a certification if you pass it. They are really worth it. And finally, we have this 1-minute video that I think exemplifies what we have been talking about. If we could play it, thank you so much. Distance between social distance in the public transport, temperature filter in the entrance, antibacterial gel when accessing the facilities, disinfection of shoes, cleansing of the dining room, social distancing in the dining room, social distancing in the offices, online meetings, these are some examples, Doctor. but I think we will have to continue stressing and bringing these examples. Thank you so much, Professor Soe. We will continue bringing this demonstration elements and so on. Let's start with our mate from Pulso Saludable, and then we will go with Lisa Hernandez, and then we will go with Daniel. Thank you. Good evening, Liliana Núñez, Pulso Saludable. Professor Jose Robledo, I would like to ask you, are you going to have some type of visit to the companies to ensure that what you are describing in this questionnaire is actually happening? For the Minister of Education, what is going to happen in the case someone is infected and the school is shut down? How the educational process is going to continue? And Dr. Gattel, last time you were explaining about R0, this quantification of the transmission spread. Did we consider this to decide that the safe distancing campaign was finished, or what was the reason for finishing? Thank you so much. When we do the self-evaluation, we accept a couple of things. First, there is an advice or the request of evidence of the application of this protocol from the Seguro Social. However, in this agreement, this is something that is mandatory. The work secretary can conduct inspections that are related with the application of protocols, and this can also be conducted by COFEPRIS. So yes, we can have this type of random inspections. And if there is a company saying that they have an element of the protocol and they do not have, we will conduct the closing of the facility immediately. In the event there is a person who is infected with COVID in a school, this will be closed. It must be closed for at least 15 days so we can ensure there's no problems with anyone else. I don't know if Dr. Gattel wants to mention something about it, but it would be a temporary closing to ensure there's no other contagious infections. Well, the teachers, the same way we did in the break in March, they will ask children to take their books home so they can have these 10 business days with a study guide. So the expected teaching are in the free textbook. In relation with what Professor Moctezuma said, why 15 days? It is standard in the public health to leave at least 2 incubation periods. The average is 7 days, so 14 days total, and that's the time frame where we could be sure that there's no case, spreading case. And we face this suspending the school activities temporarily. We faced this 11 years ago with the influenza pandemic. That was one of the measures that we used, and it had to do with this idea of suspending the change of contagious in the school facility. About R0 or effective 0 RT. This is the basic reproduction number, or the effective reproduction number is the amount of people that can infect someone who is within this contagious period. We kind of consider this, it's one of the elements of monitoring in the graph that I presented the other day, and also in the reports conducted by our colleagues, the mathematicians. We have this representation per state and also per city. So we're going to use it as part of the color coding system for monitoring. But the question in terms of why today is finishing the safe distancing campaign is, from the beginning we consider focus actions. Do you remember a chart, a green chart, yellow, orange, and green, with focus actions with the expectation that we would be able to identify the focalized patterns of the pandemic from the beginning. Truth be told, we noticed that it was reasonable, the transmission was reasonable to disperse from the beginning, and we considered that it was really important to have a national intervention, and this interruption of the activities in national education system that Professor Moctezuma Barragan mentioned, it was a very good opportunity because, as we have mentioned several times, with this central decision, we break the circulation in the public space of almost 40 million of people. So that was the pivot of the safe distancing campaign. Then we have the two other points, social one and work one, and this allowed us to have a national impact. And now that we have this clear focalization, when we have epidemic asynchronity, we consider that the most important would be to have a regional management clearly supervised for the National Health Authority or the color coding system. That's the importance of having one color coding system for the entire country. People is quite scared because why do we need to come back to normality when we are not? Let me just summarize this in a single phrase. Don't be scared. First of all, to go back to the new normal doesn't mean like it was before. It doesn't mean to go back to the street. It doesn't mean 24 hours of Monday, June the 1st, everyone is able to go to the street to do normal activities. It doesn't mean like store companies are able to open. No, that's not what it means. Where we have red color coding, as it's mentioned in our guideline published in the agreement published on May 15, only those essential activities are able to be working, including the three new essential ones, which are construction, mining, and the autos section. That's it. This is based on the color coding system. In those states where the color coding system switched to orange, for instance, Zacatecas, they might consider, those states might consider reopen, escalated those activities that are non-essential right now. But if that state, for instance, Zacatecas, considers that it is not time yet, even when they are in orange, then the government of Zacatecas is fully free, and we will back up to decide that it is not time to open those activities that are non-essential. So coming back, those states are able to take additional measures to the ones of nationwide, so we can restrict the mobility in the public space, but not otherwise. Liz Fernandez, please, from Grupo Cantón. Good evening, everyone. Lisbeth Hernandez from Dario Basta, Grupo Cantón. Yesterday, I was going to ask you about people with arthritis who have been for 2 months without therapy and without medicine, and you were going to answer about this. And the second question, for the Minister of Education, Esteban Moctezuma, he said that it's going to be mandatory for children to wear a mask. Yesterday and today you are wearing it. I want to know if this is an example that you are setting for them. For the first question, thank you so much, Lisbeth, from Grupo Cantón. I noticed your news story for Hospital Dario Fernandez from ISTE, and I noticed there is a problem with the functionality of the service in that local state. I looked to see if that was a general issue having to do with lack of supplies or problems with the protocols. That's not the case. It's a focus issue for this hospital, and I have notified the director of Ecoliste and the general manager of ISTE, and they answered that they will follow up regarding this situation. Minister, it is not since yesterday that I'm wearing a mask. Zoe and Hugo can tell that from the beginning of the pandemic, I've been wearing it. And I think if we are asking children to wear this mask, and also the teachers, it's just for congruence that we should wear it. I thank you for the answer and for the question. We actually can testify that he has been wearing it since the beginning. What I have mentioned, the day that I was wearing a mask in a meeting in the Seguro Social, the mask is an auxiliary measure particularly useful when we are using it for a short period of times in localized spaces, particularly spaces where we are not able to ensure a safe distancing. Public transportation, classrooms are very good examples of the places where we benefit the most of wearing a mask. And I also would like to mention that there is scientific evidence that mask is a barrier for the ones who have the virus, and we want for them not to spread it. And it is particularly important. The specific evidence is not clear in terms is a protection mechanism. And when we wear it along the entire day in several types of usage, it is likely that it won't provide us the impact that some have mentioned. We don't have scientific information regarding this, but for very specific situation, for small periods of times when it's not likely to guarantee the safe distancing, mask is welcome. Daniela, please. Thank you, Daniela Pastrana from Pie Plágina. I have two questions. One is about tourism, because the color coding system is clear for very specific places, but in terms of tourism, when you need to move someone from one state with red color coding to another one, green from green to red, how are you planning from this to happen? And then for IMSS, how can you guarantee that the disability leaves are going to be respected? We have noticed that in some cases, the companies are actually hiding that their workers are sick, or they don't want to give sick leave because they don't have COVID, because not everyone has been tested. And for instance, the minister Moctezuma was talking about the calendars to return classes. I have this question with these universities that work with 4 months system, or Ibero that has summer period. And what about these students that represent this 10% who could not reach distance educations because of the lack of internet, electricity? Is there going to be any specific plan, recovery specific plan, like a CONAFE, or what do we have for these children living in distant areas? We have 35 seconds, so we just have a small answer. So Professor Esteban Moctezuma, the remedial training course that is the one we will start 2020 cycle. It's for all the elementary systems. There we will be able to fight again those left behind. There we will find those left behind, and we will work the entire year with that. So that's the time where those who were left behind will be receiving the most of attention. And those sick leaves, from the very beginning of the statement, we establish a mechanism to do that at distance. We're not requesting them to attend to the hospital or the facility. We explained that the disability can be online by filling a survey. We have 247,446 people requesting sick leave. If you allowed us tomorrow, maybe before 7, in the conference at 6, it has to do with an economic area. We will explain the register of these sick leaves, because we have had many of them, particularly because one of these intentions was to prevent those people with minor symptoms go to the medical facility, then go to the bank and go back to their homes using public transportation, so we could cut the contagious chain. So sick leaves must be granted. This has happened massively. So maybe tomorrow we can present a report. And about tourism, I will explain it later. Tomorrow we are going to have this special event because the ministers of who will come, and we are going to talk about tobacco. Tomorrow is the day against tobacco world. And so we are going to have this special event. So if Minister Moctezuma, Teacher Robledo, I would appreciate if we could move these topics for next week, maybe Monday. And tomorrow we will have the Minister of Economy, the Minister of Health, the Minister and we are going to talk with functionaries of WHO, particularly about tobacco, COVID, and then the general tobacco as one of the main causes of damage in health. Tobacco is always against health. And just for you not to have the wrong information, we have provided 54 disability sick leaves, something we call 15,456 sick leaves, the ones that have been provided. It has been an important number. For other diseases are different, but Monday, Monday, we will provide you the full record. Thank you so much, everyone. Good evening.